Adoption of geriatric technologies, perception of patients and their carers. My top 5 papers for digital health 2018 to 2019. Hi, my name is Monique David and I am a registered nurse working as an after-hours nurse supervisor at Blue Cross Residential and Community Services and as a rehabilitation nurse at Epworth Rehabilitation Hospital in Camberwell. The focus of my review is geriatric technology and the perceptions of stakeholders, patients, informal and formal caregivers. I chose this topic because in both of my jobs, the main clientele are the elderly. And geriatric technology are perceived to give support, but I haven't seen a lot of technologies used in my practice. I am curious if the perception of stakeholders affect the usage of technologies either at home or in an institution. According to United Nations Population Study in 2017, the global population aged 60 years or over are numbered 962 million. It is more than twice as large as in 1980, where there were 382 million older persons worldwide. The number of older persons is expected to double again by 2050, when it is projected to reach 2.1 billion people. Demographic change represents enormous burden for the care sectors and resulting in high proportion of people in need of care and lack of care staff. Technologies have the potential to support the bottleneck in care supply, but are not yet in widespread use in community and institutionalized contexts. What is my search strategy? So the databases searched are PubMed, CINAHL, Google Scholar, and Discovery. It is limited from the studies in July 2018 to 2019. The keywords used are technology, aged, perception, caregivers, or carers. The total number of articles retrieved are 134, and the number of articles shortlisted for review are 8. And out of that, I picked the top 5. What is my rationale for picking the top 5 papers of the year? Rationale include adoption of geriatric technology, perception, acceptance, and barriers realized, and the stakeholders are patients, informal, and formal carers. The first study is acceptance and use of innovative assistive technologies among people with cognitive impairment and their caregivers, a systematic review by Dottir et al. The purpose of this study is to synthesize the knowledge on facilitators and barriers to innovative assistive technology use, including acceptance and adherence to technology among older people with cognitive impairment and their informal and formal caregivers. It is a systematic review of databases CINAHL, PubMed, Inspect, PsycInfo, published between 2007 to 2017. A total of 1,655 individuals participated in 30 included studies. They were people diagnosed with mild cognitive impairment or advanced or severe dementia or Alzheimer's disease, their formal and or their informal caregivers. The included studies were performed in Europe, USA and Canada, Australia, and Asia. The main facilitators for acceptance and adherence to innovative assistive technology use identified were ease of use, familiarity with technology, improvement of care, low technical demands, enjoyment, possibilities for new interaction, and feelings of safety and personalized fit to daily routines. How and when the technology was introduced and the provision of support before and during the implementation were highly relevant for the acceptance and adherence of the IAT. Barrier factors were the participants' lack of experience in technology in general and the age of the person using the technology. Due to disease progression, regular follow-ups to adapt the technologies to the changing needs of the client, as well as to those of the formal and informal caregivers are needed. The next study is perspectives of stakeholders on technology use in the care of community living older adults with dementia, a systematic review by Van Boko et al. The purpose of this study is to provide an overview about what is known in the scientific literature about the perspectives of different stakeholders who are involved in using technologies for community living older adults with dementia. The method is a systematic review of databases PubMed, Web of Science, PsycInfo, sociological abstracts, and sociological services abstracts since 2006. The main facilitators shared perspectives among persons with dementia, informal and formal caregivers were ease of use, stability, flexibility of technology, importance of privacy, and confidentiality. The study also found that among older persons, fun and pleasure, in addition to freedom and independence, facilitates technology use. Informal caregivers' peace of mind and relief of burden also appeared to be important in using technologies. Formal caregivers value the potential of technologies to improve the monitoring and communication. Invasion of privacy, dehumanizing care, and less face-to-face contact are perceived barriers of technology according to patients and their carers. The third study reviewed is Nothing Else Matters: Trade-off between Perceived Benefits and Barriers of Ambient Assistive Living Technology Usage by Julia Offerman Van Heek and Martina Zaifel. The, the purpose of this study is to investigate people's decision between selected perceived benefits and barriers of ambient assistive living technology usage, taking the perspective of a caring relative into account. An online survey was conceptualized asking 140 people of different ages for their acceptance and decision behavior regarding the usage of ambient assistive living system in Germany. Acceptance factors include the increase in safety, higher efficiency in emergency case, possibility to live longer at home. The barriers are personal costs, fears of technical failure, fears over privacy issues, and the question what data are collected and how they are used, and up to the wishes to live in dignity and intimacy at home at older age. The study has identified two conversely deciding user groups. The first group, mostly young academics, around 30 years of age, with no previous care experience, and a second group, which is on average 10 years older with more life experience and a profound experience in care. Care experienced persons' decision rely more on emotional aspects and close relation between the caregiver and the care receiver. Unexperienced persons, in contrast, rely on more rational reasons, like competency of professionals, and entrust medical authorities with the responsibility of data access. The fourth study reviewed is the promise of assistive technology in institutionalized old age care, economic efficiency, improved working condition, and better quality of care by Sarin et al. This study examines how various stakeholders view the potential of assistive technology in an institutionalized care setting in Denmark. It used ethnographic field observations, interviews, document analysis, and the study has explored the residents, the staffs, and the municipality's perspective on technologies and analyzed whether they live up to the stated expectation. This study investigates the outcome of a municipal trial project. which is part of a Danish municipal program aimed at increasing the use of assistive technologies in Danish municipalities. The project was implemented in residential care homes for older and disabled citizens in a medium-sized municipality in Greater Copenhagen in 2016 to 2017. The results are as follows. Municipalities' triple win narrative emphasizes expected gains in terms of efficiency, improved working conditions, and better quality of care. The staff's ambiguity narrative contains both negative views regarding the motive for the use of technologies to save resources and positive accounts of how technologies have reduced work-related pain. The residents' limited agency narrative reflects an internalization of the staff's perspectives. The study demonstrated that the potential of assistive technology for efficiency of care, improved working conditions, or quality of care are highly context-specific and dependent on residents' characteristics, daily changes in care practices, assistive technology implementation, and staff acceptance and use of new assistive technology. The fifth study reviewed is They Don't Care About Us, Care Personal's Perspective on Ambient Assisted Living Technology Usage, a scenario-based survey study, again by Offerman, Van Heek, and Zaffel. The purpose of this study is to investigate professional caregivers' ambient assisted living technology, or ALL, acceptance, and their perception regarding specific technologies, data handling, perceived benefits, and barriers. The method is a web-based survey of 170 professional caregivers, including medical, geriatric, and disabled people's caregivers in Germany. The results are as follows. Professional care staff has a more critical concern in the integration of AAL technologies into their professional routine. The only accepted data collection was regarding emergencies. Other data types were tolerated, if not rejected. Fears concerning data security, as well as general discomfort of being monitored in intimate care situations, are viewed as barrier factors. While medical and geriatric care professionals are generally more positive towards AAL technologies, the professionals working in disabled people's care are more reluctant towards the usefulness of AAL systems and perceived higher concerns regarding data collection in care situations. Summary. Technology plays a part in improving the independence and quality of life of the elderly. It is decreasing the individuals and public's costs by caring by preventing and managing incapacity and frailty of the elderly. Technology also provides groundbreaking solutions to improve well-being, mobility, accommodation, interaction, and quality of life of both older subjects and their caregivers. Perceptions such as psychosocial and ethical issues, acceptance by end users, barriers perceived may weaken the comprehensive use of technology in older age and their caregivers. A great effort in interdisciplinary partnership is needed to incorporate technology into existing health and social service systems. Future research should look into a large-scale implementation of geriatric technologies, taking into account the perception of all stakeholders. Through this study, I have developed a continuum for development, management, and evaluation of geriatric technology. Technology design and effects need to satisfy the expectations of elderly and their caregivers. A more individually designed technology is needed for the end users to be motivated to use the innovative technologies. Technologies in care contexts must be tailored to care professionals' needs and concerns. Insight regarding perspectives of involved stakeholders is crucial since it may influence, impede, and enhance technology use. Understanding the positions of elderly and their carers, differentiating between the respective perspectives can help both scholars and product developers understand the potentials and risks of technologies. Lastly, technology needs to be continuously evaluated for the evolving needs of all stakeholders. Patients and carers need the support in education regarding technology use. These are the references of my 5 studies, and thank you for listening to my report.